Hey guys, I wanted to just make a really short video on cupping today. Those of you who have had an explant or are thinking about having an explant may have heard of women using the cupping techniques to break up some scar tissue that is left after surgery. So cupping, these are the cups that I have here. They are silicone cups. We do not recommend the glass cups or I think they do some kind of fire cup. We don't recommend either of those for cupping after surgery near your breast area because your breast tissue it's just too fragile. So, those are going to be too invasive. So you can go ahead, Amazon, just get yourself a decent silicone cupping set. I think these were about $25, and they came with all different sizes. These are just the two that I chose for today. So basically, cupping is an ancient form of alternative medicine. So it's been used for years, and the process really is for it creates a suction and it decreases inflammation, it increases blood flow, and it's used sometimes for deep tissue massage. For our purposes after explant, what we would be using the cupping technique for would be to break up the scar tissue and break up some adhesions that are left after the trauma of surgery. Now, I'm going to let you know I'm not a medical professional and I'm not a cupping expert, so take my advice for what it's worth. This is what I've learned just by being in our support groups and seeing what has worked for other women as well as myself. So for me, after my explant, I was left with not much at the top here. So this is called your upper shelf. There was really no cupping that needed to be done here because all of my breast tissue had fallen down. Which wasn't a lot, but there was some. And if you have heard of the term fluffing, that is just something that kind of happens after surgery and after the trauma is over. Our breast will tend to fluff up a little bit. So cupping is just a technique to kind of help that along. And so really where the breast tissue is and near your scar area, that's where you're going to be doing your cupping. For today's video, I am not going to be using a breast because I tried sharing a video of breast cupping once and I got kicked off of social media. So they didn't like it. They said it was pornographic. So I won't be using a breast today. I'll be using my leg. So I'll show you what I'm talking about. A lot of times the cupping that you'll see is where they'll take the cup and they'll suction it onto the area and they'll leave it there. All right, so now this is creating a vacuum type of suction, and it's going to help, reduce pain and inflammation and all of that. So a lot of people like it on their back and things like that. But what I'm going to show you today is more of a dynamic cupping technique where you're going to use a lot of lotion so that, you're able to actually move the cup along the area that you're going to be cupping so that you're going to be breaking up the adhesions and the scar tissue all along the bottom of the breast area. And that's really going to, if you have a problem area, you could leave the suction on there for a while, but my suggestion is because our breast tissue is so delicate, you don't really want to leave that suction on there for too long. So I would really use more of a dynamic technique. Okay? Okay, so here's my breast, and it's drawn on my leg to show you. My suggestion is to definitely use lotion, and you don't want to create any friction because you would probably be doing more harm than good. So definitely get yourself lathered up with some lotion in the area. Okay, so your scar would be about right under your breast here, and this is kind of where your breast tissue would adhere and create some problems where and this is where you would want to, kind of help the fluffing along. So, depending on the size of your breast, you would pick the size of the cup accordingly. So I have a small one here, and you basically press into the cup, and then once you place it on, it's going to create some suction. Okay, so it just stays there. And what I want you to do is, rather than keeping it there, you're going to create the suction in this manner, okay? So there's just a slight suction against my leg breast here. And as you can see, it's kind of sucked in the lotion with it. And this is why you want to be generous with the amount of lotion that you use, okay? And so it's just creating this little vacuum, and it's pulling away those first few layers, and it is going to break up those adhesions and the scar tissue that you have right under that breast area. And you want to go gently because your breast is going to be sensitive, and it is going to, it's just a very delicate area, okay? Unlike my thigh here, your breast tissue is going to be much more delicate. So that's basically how you do it, okay? And the suction will stay for quite a while. Like I said, you don't want to leave it on there in any one area too long unless it's a problem area. But the other thing is that you do not want to do cupping immediately after surgery. Okay, cupping should definitely wait 4 to 6 weeks, and you need your surgeon to give you the okay to go ahead and do it. All right? So just like that. I'm going to show you from this angle too. You can see the cup is still here, okay, still vacuum sealed here, and I'm just moving it along this way. Okay, so that was just a very brief explanation, demonstration on cupping after explant. And I hope it was helpful. Because when I was looking for videos, you know, there was an amazing woman on our support group, Carmen, who she knows so much about all of this cupping, but to find a video was really difficult. And like I said, when I did find a video to share, I was kicked off for pornography. So I know using my leg was kind of silly, but it was the best way that I could think of to show you guys, you know, just kind of how cupping is done after explant. So again, the cupping set that I have is a silicone set. I got it on Amazon for 20-something. You don't have to spend a lot of money. Don't use the fire cups. Don't use the glass cups. They're too harsh for your fragile breast tissue. And definitely get your surgeon's approval before doing any cupping, because after the trauma of surgery, you don't want to do any harm to your fragile breast tissue. You want to wait until there's enough healing there that you're not going to harm yourself and risk any bleeding. So again, not a doctor, just a girl trying to figure it out and help you guys along the way. So that's it. All right, I hope it was helpful. Let me know if it was helpful, and because that's just helpful for me to know. Okay, thanks, bye.